Hi, and thank you for joining Telecare's Consultant Corner, a short video on general health inquiries submitted by local Australian GPs, answered by our Telecare physicians.
Hi, my name is Jennifer Yeo, and I'm an obstetric medicine physician and nephrologist, and these are my 3 tips on managing women with hypertension in pregnancy. So my first tip is to measure blood pressure in pregnancy accurately, and this is absolutely essential to appropriately recognize and treat hypertensive disorders in pregnancy. As we all know, hypertension in pregnancy is a reading that's greater than 140/90, and ideally a blood pressure should be checked after a period of rest in a quiet environment. The woman should be seated in an upright position with the arm at the level of the heart. And also the cuff size is extremely important, as a too small cuff or too large cuff may overestimate or underestimate the blood pressure. So the actual cuff length should be 1.5 times the circumference of the arm. And lastly, white coat effect is quite common, especially in pregnancy. So if you do get a high reading, it is important to repeat the blood pressure again after at least 15 minutes. And more than 50% of women who do have that high initial reading greater than 140/90 is more often than not due to this white coat effect. A useful strategy to assess whether there may be an element of white coat hypertension is to get the patient to measure blood pressures at home, and importantly, ask the patient to bring in their cuff to the clinic so you can calibrate their reading on their machine with the one in the clinic. My second tip is to know your pregnancy physiology so that we know what is normal and abnormal for blood pressure in pregnancy. So in the first trimester, there is a marked reduction in the systemic vascular resistance due to the effect of progesterone. And this causes a gradual reduction in blood pressure starting in the first trimester, which reaches a nadir blood pressure at about week 20 to 22 weeks gestation, and followed by a gradual rise in blood pressure back to pre-pregnancy values towards term. So blood pressure follows this gentle U-shaped curve, and this explains why week 20 gestation was chosen to divide pre-existing or chronic hypertension with gestational hypertension and preeclampsia. So my third tip is a list of things that make me worry as an obstetric medicine physician. The first is severe hypertension. So any woman who has a blood pressure greater than 160/110, that is an obstetric emergency, and these women should be referred urgently to their nearest OB triage. And the reason for this is because these blood pressure readings have been associated with maternal cerebral hemorrhage. My second item in that list is difficult to control blood pressure in the first trimester, which is associated with worse maternal fetal outcomes. And this should really be a red flag, and these patients need to be managed closely by a high-risk obstetrician, as well as a physician experienced in managing blood pressure during pregnancy. My third item is don't forget secondary causes. So in pregnancy, women are often young. Often it may be a first presentation of hypertension, and it's not at all uncommon for us to see women who present for the first time with a secondary cause such as an adrenal adenoma causing Conn syndrome or Cushing's, as well as pheochromocytoma. So it is important to think about the secondary causes. And lastly, don't overlook women who normally have a low blood pressure even before pregnancy. So for example, a systolic readings in the 90s. And during the pregnancy, if this blood pressure rises to 130, even though it doesn't technically meet the official criteria for hypertension in pregnancy, which is greater than 140/90, this delta rise in systolic blood pressure is significant for her, and again should be raising alarm bells and signals someone that we should be monitoring a bit more closely. So those were my 3 tips today. Thank you very much, and see you next time.
Thank you for watching. If you would like to submit a question to Telecare's Consultant Corner, please feel free to email us at admin@telecareonline.com.au. Telecare, putting the care into telehealth.